Joining me now is the founder and president of Whole Woman's Health, a privately owned abortion provider. It operates clinics from New Mexico to Maryland. It offers abortion medication by mail. Welcome to the show. First off, how are you and your staff navigating these latest court decisions, and what are you telling your patients?
Thank you so much for having me. You know, it is really frustrating to have so much uncertainty and so much back and forth, not only in the court systems, but really all over this country since Roe v. Wade fell 9 months ago. We're coming with a very clear message. Our clinics are still open. People can still get access to safe abortion where abortion is protected. And we can offer abortion with Mifepristone and Mifepristone still, which are the two medications that are approved by the FDA and that have been in play in this country for over 23 years. More than 5 million people have used Mifepristone to terminate their pregnancies very safely and effectively in this country. And so trying to have a simple message for our patients, because they have been through so much uncertainty and change. They're traveling hundreds of miles in some cases in order to get abortion care. And so, lots is up in the air. The staff and the patients are confused or have uncertainty. And, that's part of the intent with abortion regulations and abortion restrictions like this.
Yeah, and it's been just really amazing to see how your company has been so nimble and tenacious, especially navigating this post-Roe landscape. Do you have a backup plan, or what is the contingency plan come Wednesday? Right now, women have full access to Mifepristone until potentially, there's a decision made at the Supreme Court level, or if it's thrown back to the states. I mean, what are you planning right now?
Sure. So at Whole Woman's Health and at most abortion providers in this country, we have lots of backup plans. Unfortunately, being an abortion provider in the American South and in the Midwest for decades now, we've always had to have multiple levels of backup plans because there has been regulatory interference and restrictions like abortion bans and delays, et cetera, for a long time. So for those of us working in this abortion space, there's a trajectory. The Roe v. Wade overturn, things like 6-week bans, things like this kind of restriction don't surprise us, because we know that the anti-abortion forces want to end abortion by any means that they can, and that they're not satisfied only with overturning Roe, that they're interested in restricting abortion access for everyone in this country, even if you live in some of the places where I think people think abortion is protected, on the coasts in some of the more progressive communities. And so we are trying to center abortion as part of regular medicine. Abortion is essential medicine. We learned that during the pandemic, and just trying to get people access to safe abortion as early in their pregnancy as possible, and with clarity, and trying to cut through this misinformation.
And, so many abortion providers like you have had to jump through so many hoops, right? And in case in point, Whole Woman's Health just opened a new clinic in New Mexico, I think 3 weeks ago, if I'm correct. And that's because Whole Woman's Health had to close 4 clinics in Texas after Roe v. Wade was overturned by the Supreme Court. What is your biggest concern right now if the availability, access to Mifepristone is restricted in some way?
So yes, we're open in New Mexico, and we did have to close those 4 clinics in Texas, and we're also open in Minnesota and Virginia and Maryland. And my biggest concern is that people won't get access to the safe abortion care that they deserve. That in this country, which stands for human rights and justice, according to sort of how our country was founded, that we're seeing restrictions on one of the most common and safest parts of our healthcare system, just because a small group of people's feelings and beliefs, and those people happen to be in power right now. I think what we've seen is that abortion and access to safe abortion is incredibly popular and valued by the majority of people in this country. And so we've got to make sure to have access to Mifepristone, like you've been talking about. It's one of the most common, and it's also the preferred method of abortion care for many people in this country. The majority of folks that we serve choose to have abortion with pills and choose to have abortion with Mifepristone and Mifepristone. And like I said, we've had millions of people in this country end their pregnancies safely and effectively using this medication. And
Yeah.
so what's at stake here is radical and it's extreme. And it also doesn't represent what the majority of people in this country want and what we value.
Amy Hagstrom Miller, I don't think I mentioned your name off the top. So Amy Hagstrom Miller, I'll say it twice. Thank you so much for your time with A Whole Woman's Health.
Yeah.
Thank you.